Hey, Dr. Kenneth DeLay here, board certified urologist practicing in West Columbia, South Carolina. I use this channel to educate my audience on issues pertinent to urology, sexual health, health policy issues, and other life musings that come up. If you enjoy what you see, please like and subscribe and turn on notifications so that you can see future content as it is released. Today I want to talk about an issue relevant to pelvic health, which can be disabling, life-changing, and frustrating for the patient. That is interstitial cystitis or chronic bladder pain syndrome. It is a syndrome, meaning it is a grouping of symptoms without a clear cause or explanation. The Society for Urodynamics and Female Urology, SUFU, define it as, quote, an unpleasant sensation, pain, pressure, discomfort, perceived to be related to the urinary bladder, associated with lower urinary tract symptoms of more than 6 weeks duration in the absence of infection or other identifiable causes, end quote. So to restate this another way, it is pelvic pain which appears to be coming from the urinary bladder, which is chronic or long-lasting and doesn't have another explanation after a reasonable diagnostic evaluation. It is more common in women than men, but can affect both sexes. The course of IC can wax and wane in intensity, meaning that symptoms can come and go. Some patients are affected much more profoundly than others. It is associated with anxiety and depression, although it is unclear if the disease causes these symptoms or if someone with anxiety and depression is more likely to have IC. There are multiple theories for the development of IC, including 1. Hypersensitive pain nerves coming from the bladder, 2. Inflammation in the bladder, 3. Excess tension in the pelvic floor muscles, and 4. Problems with certain connective tissue elements in the wall of the bladder. Some patients have more pain and others have more urinary symptoms, but pain must be present to have IC as a diagnosis. Several findings may suggest IC as a diagnosis. 1. Normal urine studies. 2. Pelvic floor tenderness on physical examination. 3. Lesions called Hunter's ulcers may be seen when a scope is placed inside the bladder, what we call a cystoscopy. IC can have a number of triggers which can make the symptoms worse, including 1. Psychological stress, 2. Certain foods and beverages, 3. Poor voiding habits including holding urine, 4. Certain medications and supplements. For the male patient, symptoms are often labeled as chronic prostatitis. The American Urologic Association algorithm lists multiple lines of therapy for IC, and we will review those here. Number 1 is behavioral therapy. This includes education about the disease process, stress management, and referral to pelvic floor physical therapy. Pelvic floor PT is crucial to learn about appropriate muscle relaxation and can improve pelvic pain and sexual function. 2. Oral medications. These include amitriptyline, cimetidine, hydroxyzine, and pentosan polysulfate or Elmiron. Elmiron is the only FDA-approved medication for IC. 3. Bladder installations, where a catheter is placed into the bladder and medications are instilled. Number 4. Cystoscopy and hydrodistension, where the bladder is stretched with the help of fluid, and this helps some patients, but not all. Others are helped with the injection of Botox into the wall of the bladder. If this is effective, it does usually need to be repeated up to every 6 months. Placement of an interstim or bladder pacemaker can help some patients, especially those with voiding dysfunction. And 5, finally, for some patients with end-stage small scarred bladders, you may consider removal of the bladder and creation of a diversion called an ileal conduit. If the bladder is small and scarred and Botox doesn't help with the capacity of the bladder, stowing a patch of bowel onto the bladder called an augmentation can help. These last two procedures are quite invasive and would be a last resort. Obviously, we start with less invasive treatments and work our way up. For most patients, multiple lines of therapy will be needed to bring about significant improvement. Unfortunately, it's not always easy to predict who will respond well to which treatments, so some trial and error is inevitable. While IC is not curable, it is a treatable disease, and the goal will be to improve quality of life while minimizing side effects from treatment as much as possible. I hope you enjoyed this video. If you did, please like and subscribe and turn on notifications so that you can see future content as it is released. Thanks for watching.